Hi, I'm Diane Stelz, and my final innovation project is how do we teach those that do not want to use a computer? Defining the real problem is the first step towards solving it. So what is the real problem? We have patients that just don't want to use a computer to learn. Maybe they don't have access to a computer, perhaps a lack of knowledge or are afraid to ask for help. Maybe they just don't want to be bothered looking things up. Whatever the case may be, we need to make sure that they have access to the same quality of care as those that will join the LVHN portal site. Teaching is supporting, empowering, engaging, caring, sharing, reflecting, nurturing, and assessing. So what's next? Brainstorming. I've been thinking and came up with a few things. Home visits. When in a patient's home, you can see their environment, the rug they can trip over, the food they eat, the stairs they have to climb, their everyday challenges. People feel comfortable in their own home, and what better place for teaching to occur but where they feel as though they are in charge and not in a sterile office setting where everything seems cold. Some of the cons for this could be the cost of getting doctors or nurses or even, other practitioners into someone's home regularly to continue the teaching process. Next would be the interactive booklet, a personalized booklet given to the patient with explanations of diseases and pictures related to their disease process. Even a crossword puzzle or word search related to their disease, which will help them to learn more about it without having to read yet another page of boring information. It would be interactive, so to speak, where pages could be added, and when they are at home looking at it, there would be space for them to jot down questions. They would be encouraged to bring it with them every time they have an appointment, so it could be used to further the teaching process. New pages could be added and questions addressed. Basically, this is the computer information, but in booklet form. Cons would be it would have to be adapted for different languages and different reading levels. And my last thought was the 5x8 index cards, held together with a ring, used somewhat the same as the above booklet. Many patients may like it better as it appears to be quicker reading than perhaps the booklet can seem intimidating. There would also be space for questions, and the patient would be encouraged to bring it to all office visits. Cons, as above booklet, it would need to be adapted to patients with different languages and different reading levels. And because it's a little smaller, it could be difficult to use for those with visual difficulties. My preferred method is the interactive binder. We take an empty binder, add information from the computer pertinent to their disease. Let's use hypertension. Show them what it is and what can happen if left untreated. Teach them how to take their own blood pressure. Have them chart their blood pressure each day and add that paper to the booklet. Information in the booklet can assist them in maintaining low-salt diet, which is all added in the booklet. A blank page for question and answers while they are at home. They would be encouraged to bring it to every appointment, including that of other specialties. Allow time for questions and answers. Be sure to answer their questions one at a time with teachback. In other words, explain it and then have them re-explain it in their own words. Make sure your true intent is understood. And the assessment. Is this working for the patient? Is this the best way for him or her to learn? We made our assessment, implemented it, assessed it, and now we need to make necessary revisions needed for that particular patient. The elevator pitch. There's always a portion of the population that hesitates to become part of the mainstream of healthcare technology. For whatever reason, they simply don't want to use a computer, which means that some patients won't have the same access to quality teaching as those who are engaged in their electronic health care. An interactive booklet can be an alternative for those patients who opt out of using a computer to still get pertinent healthcare information. This information is inexpensive to produce, easy to update, and customizable. Unlike your desktop, it's convenient to take to physicians' appointments where the information can be reviewed with your healthcare providers. Ask your provider if the interactive booklet can be used for you.